Hi, good morning, good afternoon, wherever you are that you're catching this on YouTube or any other social media platform that we have. This is Christina Leo. I'm with Negative Ion Clothing. I'm so excited. This is the first episode of my inaugural Health with Negative Ion or Antioxidant series. And I couldn't be happier to have my first guest. My first guest is Laura, who I'm so excited how I met her and how I found her. And there was this holistic health expo in LA, and I'm always in tune to anything related to health. And I really wanted to go, but things happened, couldn't make it, and I just decided I'm going to go on the roster of speakers that are going to be at this expo. And there were probably, I don't know, probably at least 30, 40 speakers. And I'm scrolling through them, and none of them really had a connection with me. And then I saw Laura's picture, and I clicked on it, and then I said, oh my goodness, her bio is amazing. And you'll hear that from her directly. But what attracted me was the service that she provided called electrodermal screening. And it first of all, I was very intrigued in terms of what it is because anything electricity, anything linked to the body, my ear perks up. And I've been using negative ion clothing for 15 years. And I was always looking for how can I have some kind of way to show the benefit of this clothing on me? And then how can I help my customers and potential client to see the benefit? So the more I looked into her bio, the more I thought, hey, I should really reach out to her. So I reached out to her, had a initial consultation call with her, and I just felt like we clicked so well because when she said healing is voltage by Dr. Tennant, and for those of you that have seen me done presentation on that particular book, I don't come across many people that mention that book. So that was like the first indication. Then I call her. Well, we had a consultation call, and then I had a follow up, the first meeting with her, and we'll go through that in a little more detail. So what I want to do now is actually introduce you to Laura. And Laura, would you say your last name for me? I didn't want to mispronounce it.
Of course.
Okay, so I'll let her say it herself, and then I would like her to kind of give us, a brief background information about herself, and then we'll go into a couple of questions. So this is going to be very casual interview style, and then we'll see where the conversation go. Okay, Laura, take it away.
Thank you so much, Christina. I'm so happy to be here. Thank you so much for having me. And it's my pleasure always to talk with you. And it's my pleasure always to share about the work that I'm doing, about all the quantum electricity and everything. That's my passion for sure. So my last name is Petkunaite. I know it sounds difficult. It's
We'll
Eastern
just call
Europe.
you Dr. Laura. How's that?
Yeah, it's totally fine. Everyone calls me here in United States. Everyone calls me Dr. Laura, so I'm like, I'm fine with it. It's totally fine. I get that it's difficult. So my background is in Western medicine. I was extremely skeptical person. I practiced in the hospital. Always my focus was oncology, rehab, autism, all the psychiatry field, and I had a lot of health issues by myself. And no one from my colleagues, no one in Western medicine couldn't figure out what's going on, what's causing the symptoms that I'm experiencing. I used to have crazy migraines. I used to have urinary tract infections every at least 7 times per month. I was not able to do almost anything. I was not able to see with one of my eyes. I had herpetic keratitis, and all of these things, they started popping up. And I'm like, what's going on? And of course, as Western medicine provider, I reached out to my colleagues. I went to see any doctor, you name it. Like I saw every kind of specialist and back in Europe, and no one could figure out what's going on, what's causing all the symptoms. How can I heal, right? Because they keep prescribing medications. There was no need for it. For example, anti-epileptic drug or antidepressants or something like that, whatever that could work or help, but nothing helped. And my boyfriend, which is my husband at this time, he offered for me like, hey, let's try some kind of alternative medicine or something related with electricity, like something like that. And at first my reaction was, no way, I'm not going to do that. I don't believe in that, because this is how I was trained, right? That was conditioning that I had. That was something that I thought that is truth at that time. So, but I reached the point where I was not able to study, to do my work, to do basically nothing related with my health because of my health. So I'm like, okay, I'm going to try this. I'm going to go and try. And basically, after the consultation, even if I didn't believe in that at all, I didn't trust it, I didn't believe in that, but I achieved the results in 2 weeks. After two
Wow.
weeks, majority of my symptoms went away. I haven't had urinary tract infection more than 7 years, I think. And
Wow.
everything is okay. What happened there? And I'm that kind of person who wants to dive very, very deep into things. So then I start researching and understanding, like, okay, how the method as electrodermal screening, how does it work? How do practitioners work with it? Is there any differences in different countries? Any differences in practitioners' background? Who can use it? How can I use it? And stuff. So I started researching. I talked with a lot of practitioners in Moscow, in Berlin, in London, in Paris, with a lot of different people with different backgrounds to understand what just happened. And then I understood, okay, this is what I actually want to do for people. This is where I see the value in healing. And because, in Western medicine, the question is, if I see the client over and over again every 2 weeks, it means something is not working between us. There's something is not happening, right?
Right.
So I decided that this is what I want to do for people. So then I understood that, okay, if this is what I want to do, I have to have knowledge in different fields, because so far I had only knowledge in Western medicine. I cannot be objective. I only know one field. So
Mhm.
then I decided that I have to learn Eastern medicine, quantum physics. Then I finished psychology in London. Then I studied holistic health science. I studied natural medicine. I have 3 bachelors, 2 masters in different fields. So right now I'm working on my PhD. So the thing is, what I understood, if you want to be objective, if you want to provide for the client or patient what he actually needs at that specific time, you have to have understanding in different fields. Because sometimes I need the knowledge from Western medicine that I have. Sometimes I need the knowledge from Eastern medicine. Sometimes I need psychology knowledge. Sometimes I need knowledge in quantum physics. And if you want to provide the service which is needed at that specific time with that specific person, you have to have understanding. So I also had degrees and background in behavioral analysis. I work with autism. So my background is a mix of everything. I speak a lot in conferences. I love to speak. I love to share quantum physics, all the healing modalities. That's definitely my passion now. So yeah, right now I'm doing electrodermal screening for people, but the main thing that I focus on is frequency infused medicine to be able to change the results that we're seeing. But I believe that we're gonna definitely talk about it today.
Yeah. Wow, that's amazing. And as you were talking about your diverse background, it's your almost your thirst for knowledge to provide services to whoever comes to you. But then you're looking at an individual from a whole person perspective. You're not
Yes,
looking at just one aspect of it. And that whole person involves not just the physical, but the mental, the
absolutely.
emotional. Yeah, that's
And
amazing. Yeah.
I believe,
Um,
and I go through understanding that we have at least 5 bodies, right? We have
mhm,
this physical body, we have vital body or emotional body, it's the same. We have mental body, supramental body, and bliss body or spiritual body. And all of the bodies, they matter equally. We cannot neglect not even the single one. Everything matters, everything has its own place. And we have to understand, where is that disease? Where is that imbalance coming from? From which body? From where is it coming? Where we have to focus. Because the thing is, we already know that you cannot fix chemistry with the chemistry. You cannot fix mental with the mental. It's not that easy. You cannot fix the issue with the same thing that caused it. So we
mhm.
have to dive deeper. That's why I always, and I love electrodermal screening as a method because it provides so much information about that. So we definitely can talk about it too. So once we go to electrodermal screening part, there's going to be a lot.
Which is really my first question, because when I first heard about electrothermal, I mean it's kind of two words put together.
Yeah.
Electricity, thermal, it's like the skin, right? So when I was reading up on your website, and you'll share with us in a little bit, is measuring electron flow across your skin, right? Or across your muscle. And or a better term is more of the resistance of the flow, right? So in in Chinese medicine, right, we often talked about energy. It's has to flow if if you want to be healthy. And then if it doesn't flow, your energy doesn't flow correctly, then you start having disease or unhealthy conditions. So,
Yeah.
but that was what really attracted me. And having being of Asian descent, I'm more I understand more about qi, right? The energy flow. I practice Tai Chi, I meditate, so I understand that perspective. So, but then from a science perspective, looking at actual electricity flow. I mean, that is it's kind of like a different realm, but explaining similar things. So if you could just enlighten us with what exactly is electrothermal screening
Of
and
course.
yeah, go ahead.
So the thing is, the device that I'm using and the electrodermal screening in general is based on quantum physics. We working on the physics. We're not measuring the chemistry, right? Electricity and everything, that's physics. We're measuring the biophotons flow. We're measuring the very small emission of the light that your body's producing. All of that is electricity. We're trying to understand what's going on in the physics of your body. Because when you go and you do blood work, for example, you measuring what's going on in the chemical part of your body. And chemistry is extremely important. But we have to understand that chemical imbalance, it's already fourth stage of the disease or disorder or something. I always say to the clients that, hey, your disease doesn't start in the blood work. There was something before that. Mm-hmm. And the thing is, for example, we do the blood work, we measure, we see some imbalances there. We put the medicine, for example, any kind of drug on it. And what we're doing with the medicine, we're trying to fix the cell, which already damaged. So, of course, it can modify your condition. It can definitely make you feel better. For example, if we're talking about antidepressants or high blood pressure medicine, that it's very common, it can help to modify your condition. It can help you to feel better, but the outcome is going to stay the same. It's the same pattern over and over and over again because the foundation is not changing this way. Mm-hmm. Chemical with the chemical, we can modify it, but we're not going to change the foundation because the first three stages in any kind of imbalance, disturbance, symptom, we have only imbalances in the physics. And what we're doing with electrodermal screening, we're measuring what's going on in that physics of your body. How is electricity? How is light emission? What's going on in the systems in your body, but on the physics level? And we have to know what's going on there if we want to change the foundation, because your body is producing new cells all the time, over and over and over again. We know that for that, we have to have electricity. We have to have specific substances. We have to have some things to be able to produce new and healthy cell. But the thing is, for example, your nervous system, every 7 months, you have absolutely new cells. And if the outcome is the same, if you still feel depressed or anxious or something, we have to understand that, okay, what do I have to change so my body would be able to produce that new and healthy cell? And this is where all the quantum medicine, frequency infused medicine comes in, because if you can provide for the body what it needs, there is no point to produce this outcome anymore. So the thing is, with electrodermal screening, we can see where your body is. Where is it going? How is the physics of your body? Because this is where the disease starts. And basically, if you want to truly end something, if you want to heal that symptom or disease, you have to change the foundation. You have to focus on that physics. So it helps to understand where your system is on the physics level and what does it need to be able to provide that new and healthy cell, because we can see how your body is reacting to the specific supplements, how your body is reacting to some frequencies, homeopathic medicine, how that would affect your body. We can add the supplements, we can add some kind of environmental things, for example, negative ion clothing, right? And see how that affecting your body. So I really love this method. It helped me a lot. And I see amazing results with the clients. Some diseases, some symptoms that people are having for years, it changed in a few weeks. So it's like, and I always want to encourage people to think that if you have something for a lot of years, it doesn't mean that it have to take you 10 more years to treat it. No, if we can just provide for the body what it needs, because it's replenishing itself all the time. So just provide what it needs and you're not going to have that outcome anymore. So the screening is basically tool to access and understand where your body is on the physics level and what does it need to be able to heal. So that's kind of baseline.
As you're talking in my head, I'm almost thinking it's like we all have to have this paradigm shift to look at it, because the whole premise behind the screening is really going to the root cause.
Absolutely.
Right. And then, yeah, go ahead.
What I wanted to say that it helps us to identify what's causing that symptom, what's creating that symptom. Because again, as we said, we had different bodies and all of them, they have different frequencies. So depending on the frequency, when I do the screening, when I measure and see how your body is like, for example, your large intestine, your digestion system, how is that? Where is it, right? Depending on the frequency, depending on how the curve goes, depending to what it aligns, I'm able to see like, hey, maybe it's actually coming from old low-grade inflammation from, let's say, Epstein-Barr virus. Maybe it's actually coming from bacterial or viral side, maybe it's actually related with physical body. Or maybe the frequency is higher. Maybe we're talking about emotions, which is for large intestine is grief and sadness. Or maybe we're talking about mental disturbances, because for large intestine, it's not being able to let things go or controlling things, over controlling. Maybe mentality started that issue, or maybe it's more supramental body, which is related with the meaning that we provide for the things, archetypes, or maybe it's bliss body. Maybe there is something coming. So we have to understand where the body is and what's causing that symptom to be able to understand that, okay, if this is emotional or if this is mental, what kind of potency, what kind of frequency infused medicine do I need to provide for that person? Because you can always heal, and your physical body is representation of your vital body, but your vital body is representation of your mental body, and your mental body is representation of your supramental body. And we always have to dive deeper to be able to truly, truly heal, because on the same level, you're just going to modify the condition, but you're not going to change it truly and fully. So that kind of helps to understand on the physics level, what's causing that disturbance in your body and what do we have to do to change it.
I think the other thing that you mentioned that I thought it was really revealing is the fact that just because you might have had a condition for like 10 years and you've been treating it the same way for 10 years, it doesn't mean that it's going to take 10 years for you to actually reverse that, as long as you identify what's actually causing it, right?
Exactly. When you find what's actually causing that condition, and when you know what to provide for that part of the body, there is no way that it's going to take you 10 years. I saw a lot of cases which diseases, they were reversed very, very quickly, because your body always wants to heal. Always. There is no, we have a lot of controversial discussion about autoimmune diseases. Is that possible, that body attacking itself? I don't know. So, there's always a way. And usually if you find the actual cause, it's not going to take you 10 years to heal. Because your body replenishing all the time. Your bones every year, nervous system every 7 months, your liver every 16 weeks, you have absolutely new cells. So what do I have to provide so my body would change the outcome?
Right. So in a span of, let's say, 7 to 8 months, you could actually be an entirely different person.
Absolutely.
Right. So, yeah, that's amazing. And I remember going to visit you and I had no idea what we're going to be doing. So I brought my stuff that I wanted you to test for me. And then I wore all my clothing. Right. But then how Dr. Laura proceeded was actually asking me a lot about my own background, as in, how has your health been? I mean, the typical kind of question you would expect when you visit a doctor, but she goes deeper. She asks, do you go through any stress? Have you ever had any trauma in your life? And all of that. And it's meant to go deeper a little bit and for Dr. Laura to actually see me as a person as a whole and not just, that physical body that's, in the presence.
That's
So
why I always keep like for appointment, I always book people for at least 2 hours because I found it impossible to do something in 15 minutes.
when
You
you say 2 hours, and I thought, what are we going to talk about in 2 hours?
time flies, time
Time
flies.
flew, yes. Mm-hmm. Yeah, and I thought it was so helpful too in that exchange because you were able to help me understand it at a deeper level. What is it that you were trying to do to help
Yeah.
me? And then I was coming to you, really not really having any physical issue because I've been using my product for 15 years and I go to my regular primary care doctor every year for annual physical,
Amazing.
and it's always good. The blood work is always good. But then the thing is, at a deeper level, I'm always wondering, is my electrical body healthy? Right? Am I conducting all the and it's all my electrical circuitry in my body actually working, effectively. And that's why that was the draw for me to get
Mhm.
a screening with Dr. Laura, because it's just like it's something that is so abstract and you're kind of thinking, okay, is there anything else that I could be doing to make sure my body stay at the optimal level? So the other thing, so what I wanted to do is I asked Dr. Laura to send me my report after the visit. And I'm thinking, okay, I should be able to understand it. And I'm looking at it, I'm like, okay, there's a lot of green, which is good. And even
Which
when
is
we
great.
were at the office, she said, oh, you're really healthy. You everything is good. But it's kind of like trying to decipher a code. So
I
I
get
don't
it.
mind sharing my report. So I'll do a screen share just
Sure.
so that viewers could kind of get an idea what they could expect to see. And I maybe post, I will post a couple of pictures that I took when I was doing the actual screening with her.
Yeah.
I don't have it ready for this call right now, but what I'll do is I will share my report real quick. And then let's see this one. Okay. Can you see my screen okay?
Yes, I do.
Okay. So I am just gonna go to slide one. So
Mhm.
so it's a lot of numbers and a lot of kind of a description on the side, but I do notice it says points. So those are acupuncture points, correct?
Yeah, we're using some acupuncture points to be able to access the meridian, to be able
Mm-hmm.
to understand like, hey, how is electricity on that meridian? So we usually start from I always, when people come, I want to see all the main systems. Even if after our talk, it feels like, he might have some kidney issues or he might have some digestion issues. I still want to do the screening for all the main systems to understand where your body is, because everything matters. Everything is related in the body. All the organ has its own peer, or all the organs might affect different organs, and everything matters. You cannot neglect not only one system. Everything matters equally. So we always, for the first time and for the follow-up visit too, I still check where the body is. So we started from the lymphatic system. Like the first graph is for lymphatic system. We check the tonsils, we check how is around sinuses, and everything looks amazing here. Because for me, what matters, how the curve goes. When we're looking at this kind of measurement graph, we just want to see, okay, green, it's amazing. And what matters for me, how fast the curve goes, how fast your body adapts, how your body is reacting to electric stimulation. Everything matters for me. But when we're looking at the report, we can just see like, okay, the green is totally fine. We check the lung system. Lungs in general, in emotional side, is related with grief and sadness too. Large intestine, which is always working together with the lungs. And if we have some digestion issues, we might see imbalances in the lungs too. And also, if you have runny nose, for example, that might be the sign that large intestine, something is going on in the large intestine on digestion side. And here, it's not even all the points that we can check, because if I would see that there are imbalances in some systems, we can dive even deeper and check all the points in that system. Like, for example, if we see that something is going on with your stomach, we can go check, okay, how is lymphatic system around your stomach? How is nervous plexus around your stomach? We can dive really, really deep. But if I see that control measurement point and few more points it looks amazing. So that I'm like, okay, I don't have to do this for her. I don't have to check all the points. But we also check the nervous system. We check blood circulation, allergies point. It's very, very interesting to see where the allergies is coming from if people have allergies, because if we have optimal health, your body should be able to cope with allergens, right? And we have to look for the cause. Why have you allergies? Also, we check endocrine system, which is very important, especially for the woman. We want to go through it. We want to understand where it is. We want to check thyroid, all the main glands, right? And if we see that some parts of the body might need some support, then we do frequencies infused medicine. In this case, for the endocrine system, you see CMF, which is like control measurement point, endocrine system. The measurement is totally fine, but the indicational drop is 8. When we talk like for women in menopause, teenage girls, women in fertile age, we have to make sure that endocrine system is absolutely like, we're trying to put it on the gold standard. So we want to reduce that indicational drop, because if we see some indicational drops, it can be a sign that some symptoms can develop. People might experiencing hot flashes, any kind of female system related issues. So we wanted to make sure that, okay, we address that. Also, we check the heart, which looked absolutely amazing, small intestine, pancreas, spleen. We can check your protein metabolism, carbs metabolism, fat metabolism. All of that matters for your overall health. And when we're checking, depending on the frequency, we are able to tell like, okay, is it healthy physically, emotionally, mentally, and all the levels? If we see some imbalances, then we can dive deep and understand, okay, this is coming from the mental side, for example. Is it possible to treat if it's coming not from the physical side? Absolutely. You just have to use different potencies for frequency infused medicine. So we also check the liver, which looked absolutely amazing. We check the joints, stomach, all the main organs, all the main systems, actually. We check the skin. We check if there's any degeneration going on. We check how the fat metabolism going in your body. Everything matters, right? So we have to make sure that we go through all of these measurements. We checked your gallbladder, kidney, urinary bladder, which in your case looked absolutely amazing. Definitely Christina was one of the healthiest people ever give the screening for. So, but it's amazing. I love it.
Okay. So, well, yeah. So I think for a layman like myself, right? I mean, I'm looking at the green and it looks great. And as far as the numbers, the 2 columns, what does that really mean? we don't need to know all the details, but is there like a parameter that, for example,
basically what it means, to not diving into the details too much, what it means, what is the highest value and how fast the value drops. Because if the system is healthy, when we do the screening, we use very, very small direct current, which is you not even feel it, right? It's not hurtful.
Right.
But if the organ system is not able to handle that, indicational drop start to showing up. And then it's like, okay, there must be something if your body's electricity is not able to handle that small electricity that we're putting on. And that column shows us how fast the curve drops. And depending on that result, I might decide that, okay, I want to dive deeper in the system. I want to see what's going on there. Maybe there is something. So basically, it shows for me the highest value and how stable that system is, how fast it drops.
Okay, so the second column is the drop?
It's deviation.
Deviation. Okay, okay. What does ML stand for? Out of curiosity.
This is a translation, because the system that I'm using, this is German, right?
Oh, right. Mm-hmm.
And this system is based on Russian language in some countries. So what we did, we translated everything just as easier as possible so I could send the results for people. So these ID is indicational drop, ML is value for the highest measurement. So it's different.
Okay. Got it.
It's not standard.
Right. Yeah, I did remember you mentioning that you were actually really surprised in Europe. Like if you were to go to a pharmacist, when they prescribe you something, they actually take the thermal screening and kind of measure, okay, out of these 3 medicines, which one will be most in sync with your body?
Because when we're measuring, for example, when people bring the supplements, we're measuring how your body is reacting to that supplement. We wanted to make sure that nothing is creating more inflammation for the body. And yeah, back in Europe, we have some pharmacies where before you buy something, they can check and see, okay, maybe this brand, maybe this serving size would be the most beneficial for you. So it's amazing. I love that it helps to identify the supplement sizes, the amount of supplementation that you need, and it's very, very beneficial for people, especially if there is some conditions going on. Because for example, if you have some kind of low grade inflammation in the liver physics, we want to make sure that the supplements that you're using not creating more inflammation, so it's very beneficial.
Yeah, and I brought some of my own supplements for Dr. Laura to check for me, and I was just very amazed. Like for example, I take this brain supplement called OB OptiBrain, and ever since I started taking it, I always just feel like I just needed one. And when Dr. Laura looked at the bottle, it says recommended is two, but then when she measured it for me, one is actually the right dosage for me.
Yeah.
Yeah, and she said inherently, intuitively, you just kind of know what's good for your body.
Yeah, it's amazing. When people are in tune, they definitely know. Sometimes people bring something like some kind of supplements and they're like, I haven't been using this. It just doesn't feel right. So I always encourage people to believe in that. It's very important because your body going to show you all the time. So
Yes.
here it basically shows the differences between the right and left side. If we see the huge differences in right, left side, because measurement light indicational drop, we kind of talked about it, right? Because that's the same result. But this graph, it shows us the differences between the sides. And you can see that, okay, maybe some organs, maybe some meridians are more imbalanced in left side than the right side. And then the question can be for us, okay, why? Why does your one side is reacting more? So in your case, you look amazing on the physics level. It looks amazing. So I don't see that often. But
Thank you.
for some people, when they have imbalances, for example, imbalances are located in the left or right side. Then we can talk about family constellation. We can talk about relationships, about masculine, feminine side. Everything has its own place. And the consultation with every client is very different because before I meet the person, before we do the scan, before we talk, I don't know what to expect too. I don't know, maybe it's going to be mental or emotional. There are some people who telling me that, oh, I'm not stressing at all. And you see in the chart that they do, or vice versa. So everyone, consultation with everyone is way, way, way different. So if we have to dive into the sides, family relationships, we do that. If we have to talk about only physical issues, we do that. But for me, everything matters equally.
Mm-hmm. So in this chart, are we trying to kind of get the left and the right kind of like half circle to be
Yes.
as balanced as possible? Okay.
Yes.
Okay, that
That's
makes sense.
that's ideal, but you cannot find the person who is absolute like whole circle, It's
Right.
like we live in Western culture.
It would be a perfect being, right?
Yeah, but I haven't seen one yet.
Okay. Thank you so much for deciphering the report for me. It's definitely so helpful.
Okay.
So do you have like other client examples, results that that you don't mind sharing?
For the screen share, I'm not able to share the results like that, but in general, I'm working out for a lot of different conditions. A lot of people find me when they actually don't feel well. And there are some people who find me because they're interested, but majority of my clients are people with Lyme disease, some kind of complex cases, neurological imbalances, some people with depression, anxiety, female system issues, hormonal issues, basically everyone who seeks the natural healing and the way how to balance the body, how to provide for the body what it needs. A lot of mental health issues like ADHD, people with depression, anxiety, PTSD, we can help too, because I remember that we talked that every organ produces emotional and mental energy too. It's not only the emotion can cause of the disease, but it also, if you don't have healthy organ, that might make you feel more and more of some specific emotions or mental patterns. So it's very important to just put the body into alignment. So I work with different conditions, and we have great results. For example, for people with asthma who been experiencing asthma for 60 years, and then after 2 3 weeks there are no asthma symptoms anymore. We have results with females, a lot of female system issues, when a woman experiencing constant bleeding, and after 2 weeks it's over, right? So it's different in every case, but everyone feels the difference for sure.
Mm-hmm. Thank you. Yeah. And actually, I know you had mentioned about frequency infused medicine, and all I hear was medicine. So, in your head, you're kind of like thinking, okay, I need to take a medicine to help with my condition. And then when Dr. Laura gave me the medicine, it's like
Yeah.
these little tiny sugar pills. And I thought, wow, they're so tiny. And how much do I need to take? And what is it? And I'll let you kind of explain that, because
Yeah.
to me, it was like another paradigm shift.
Yeah. So basically, as we talked, if we can provide for the body what it needs, outcome changes. So the question for us is, okay, how can I provide for the body the frequency that it needs, actually needs, not something which is general for everyone, which is healthy body frequency or something. Yeah, it matters. It has its own place. But if you want to do like personalized healing for people, if you want to provide for that specific person something that it needs in that specific situation, how can I hold that frequencies? How can I infuse the frequencies into something? So we usually use sugar pellets or water as a medium to be able to hold the frequencies. Not sugar does the healing, not water does the healing. What does the healing is the frequencies that sugar pills are medium for. Basically, we saw that these sugar pellets, they held the frequencies so well for so long time that we decided, okay, that's a great way to give the frequency infused medicine for people, because it's easy to use. It looks like kind of homeopathic medicine. You just put few remedies under the tongue. That's about it. Your body takes the information, your body takes the frequencies, and then the outcomes start changing. So frequencies infused medicine, we probably have to find another word, right? Not medicine, not remedies, not pills, but frequency infused, I don't know, but right now we're saying that it's frequency infused medicine or frequency infused remedies, something like that. So it's basically, it looks like homeopathic medicine, but it's infused with the frequencies. There's nothing chemical, there's nothing more than frequencies.
Mm-hmm. And then does this frequency ever go away?
There is no such a thing that it's go away. I usually ask people to keep them in the specific bag, which helps to protect from EMF and stuff. But basically, for after one infusion, it's definitely good to go for 8 9 months.
Oh, okay, that's a very long time.
It's a very long time. Sugar is a great medium for it.
So then you just put a few under your tongue,
Yeah,
and then just
you
let it
just put it
slowly
in your
dissolve
mouth, under the tongue, or
on the
whatever,
tongue.
whenever in your mouth. But usually
Okay.
people just put it under the tongue. You just let it dissolve. The one thing that I ask for from people is to take at least 10 minutes break after and before it, right? No drinks, no food. Water's fine in the ideal case. We don't want to have water too. So people just have to wait for some time, put it into their mouth, let it dissolve, wait for some time again. That's about it. And healing doesn't have to be difficult. We don't have to use this huge bag of supplements and everything, right? And sometimes if we can just provide and heal from the physics level, the chemistry and the structure and the function, everything's going to change.
Yeah, and then you mentioned to me it's best to take it in the morning.
In your case,
Oh,
for
in
some,
my case, so it varies by individuals.
it's various, yeah.
Oh, okay.
It depends what do we see, it depends which system is affected. So it's different for everyone. Some people they have to have different frequencies in the morning, in the evening. So it's different for everyone. It's hard to say.
Wow, this is like a whole,
New world.
yeah, a whole new world. And then it's just when you were saying trying to come up with a name for the
Yeah.
frequency infused medicine, and I just started thinking, wow, you're really going in uncharted territory here, right? And I think that's why I'm so excited about what you do and your services that you provide. And I just gained so much with one visit with you, and I so appreciate you so much. So I'm sure that people will want to find you and or connect with you. And I know that you have a workshop that's coming up as well. So yeah, go ahead and if you could share with us your website or how people can reach you.
Sure, absolutely. Let me share my screen and I will show. Somehow it doesn't let me to share. Let me try again. Share screen. Fortunately, it doesn't let me to share. Let me see.
Okay. Let me just make sure that you could share. I made you a co-host. Let me see. Or what I could do is open up a browser
Yeah,
and just go to your website. Would
yeah,
that work?
you can definitely do that. It's
Okay,
going to be
let me
electrodermalscreenings.com.
okay. Okay, let me go to a browser. One second.
Of course.
Let me just find your site. Okay. Okay.
Yeah,
That's your site, right?
so
Electrodermals. Okay.
yeah, electrodermalscreenings.com. So it's basically what you can find here. You can find a lot of information about how does it work, a lot of information about me, about my background. You can you can also find some blog posts about specific conditions, how we can use it for your specific case. There's free ebook there. There's address where I'm practicing in Santa Monica, and I also have location in Brentwood. So blog posts, and also I do every month I do workshop in Quantum Clinic, which would be in East LA in Glendale. We talking about the screening. I share people how to understand their body. They can definitely try the screening. So you can find that on Eventbrite, Foundation of Healing, and we do that every month, every third Wednesday of the month. So I see that you have Eventbrite open. So if you can just go in there.
Right.
Yeah.
There you go.
So this is the workshop that you can definitely register for. And every third Wednesday of the month, I'm there sharing the knowledge, and we also take some examples. People can get the screening there to see how their specific body, how it looks like. So it's definitely worth it.
And then you could also, I think on your site, go directly to book a initial consultation with you,
Yes,
right? Because
absolutely.
I
If
had
you
clicked
just
on
press
this and
here,
then it just opened up the Calendly
yeah.
link.
And then you would have absolutely free 30 minutes phone call. We can see how can I would be beneficial for you, how can screening would be beneficial for you. So we definitely can explore and see how we can work together.
Yeah, that's what I did. I went to your website and I booked my free consult, and I'm so glad that I did because that was one of the best conversation I ever had.
Thank you so much. I appreciate your kind words.
So the video is going to be posted on YouTube, and then what I will do is I could post your link in part of the show notes, so people could click on that if they want to attend your workshop, book a free consult with you, or just to check out your blog, your website, and find out more about this really, really innovative way for us to get a snapshot of where we are, and not just the physical body, but all five bodies, and
Exactly.
coming from a quantum physics perspective. So
And sometimes it can be very, very hard proof for people. Okay, I'm doing a right job, right? I'm doing it right. My body's healthy. Like, for example, in your case, right? You know what's helping for you. You know what closing or bed sheeting, you know what's working for you. You know that it's working, and that you can definitely see that on your chart too.
and that was really, I think was very a good feeling for me. Like,
Of
when I walk out of your clinic, was the feeling that I've been doing the right thing and my health is good, and that's what we all want. I mean, that's we all want to live healthy and live the type of quality of life that we want.
Exactly.
Define how we want to live, so not to be plagued by unhealthy health conditions. So
Exactly.
yeah, so I'm so glad. Thank you so much, Dr. Laura, for spending the time with us today. And I know that we would get a lot of responses from this, because this is really, really insightful. And I hope that it's beneficial to everyone listening, watching, that this is something truly innovative. And I hope that they open their heart, open their mind, and embrace something that is so simple that
Yeah.
you could, get a better and healthier life, and with the right diagnostic tool and the right, modality that works for you. So thank you so much. And I'm sure we're going to have Dr. Laura back again. Maybe we can go into something a little bit deeper to help,
Of
the
course.
audience understand more. And I'm looking forward to seeing what she'll do for, the general, community, bringing her message to the world on what she does. Thank you so much. Do you have any final words that you want to part with our audience?
I definitely want to thank you for your service that you're doing. I definitely see and honor that you do so much for other people. And it's amazing. The work that you're doing, the passion that you have to make yourself, your family, and all around you healthy in all the ways, in meditation way, in the way that you can provide some specific clothing or bed sheeting. It sounds so simple, but you found the way how to make that even better for people. So I'm very grateful to be here, and thank you so much for your service for this world.
Oh, thank you so much for your kind word. And I felt it in my heart, your message. And this is kind of beyond just the physical. I mean, we're able to connect heart to heart, and I so appreciate you.
I appreciate you too.
Okay. Take care, and we'll talk soon.
Thank you so much, Christina.